This is my secondary assessment video, and now I have my patient. I'm going to be checking if there's any bleeding, breathing distress, just checking their skin if it's any moist or cool. Gonna be checking if there's any pain, nausea, headache, or any difficulty breathing. I also ask the patient if there's any allergic to any medications, food, allergic to any environmental effects, like pollen or trees. And I also determine if the patient is using any medications, prescriptions, or non-prescriptions. Next, I will eventually use the patient's medical history and ask them if they have any care or problems that has in the past that has led to the patient being recently hospitalized. Eventually, I'll ask the patient their last oral intake if they have ingested any solids, liquids that include food, fluid, or any medications. And then I'll find the events leading up to the incident and determine if the patient was doing before and at the time of the incident. Next, I'll be using the DOTS, which is the deformity, open injuries, tenderness, swelling, and do a head-to-toe assessment. Very short assessment based on the patient. I'll be performing assessment starting at the head, checking the pupils if they are dilated to light, checking for right to left, okay. And if they are reactive to light, also check the patient, see if any fluids are leaking. For any cerebral fluid leaking, so far so good, just a little torn. And also check the heads, shoulders or lack thereof, and also check the deviated trachea for a punctured lung. And I'll check the abdomen for any, I'll palpate the 4 quadrants of the abdomen for any internal injuries, looking for any pain. And if it is painful, I'll redo the palpation of the 4 quadrants, checking where the pain is most occurring. And then I'll check the pelvis, or lack thereof. And then next I'll be heading down to the feet and legs, checking checking at a capillary refill of the toenail beds, lack thereof. And if one of the legs is injured, so far so good. And next I'll be checking if the both legs have both a neurological, or both can feel at least. And then I'll check the patient's back, carefully turning him. And roll him to the side. Bend the patient's knees. And then I'll leave them in a knee line position.